Hello, I'm Dr. Daniel C. Potts, a neurologist from Tuscaloosa, Alabama, and a national advocate for Alzheimer's patients and their caregivers through the American Academy of Neurology. I'm the son of an Alzheimer's patient and I'm an Alzheimer's caregiver. I would like to talk to you today about Alzheimer's disease. Alzheimer's disease is the most common cause of dementia. Dementia is a condition in which individuals can no longer think normally. This thinking problem is to such an extent that it affects your daily functioning. There's a condition called mild cognitive impairment, which is not quite as bad as dementia. There's still trouble thinking and there's trouble with memory, but this is not to the degree that it affects one's daily ability to function. Alzheimer's disease, however, does eventually affect one's daily ability to function. Alzheimer's disease was named after a famous scientist at the turn of the century who discovered the changes in the brain which we think are associated with Alzheimer's disease. Alzheimer's disease is a disease of the aged. It typically occurs in individuals who are elderly, over the age of 65, and it becomes more common as one gets older, such that at the age of 85, almost half of all individuals have Alzheimer's disease. If you take into account other causes of dementia, such as stroke and Parkinson's disease, more than half of 85-year-olds have dementia. Alzheimer's disease is felt to be caused by a problem with proteins in the brain. We all have these proteins. However, certain of us who have Alzheimer's disease have a problem with the processing or the breakdown of these proteins, such that these proteins accumulate or clump in the brain in such a way as to kill and damage brain cells. When these brain cells are damaged, they quit working and they quit communicating with other brain cells. The end result is loss of memory, loss of orientation, inability to find your way in a familiar place, inability to communicate normally, inability to function normally in your own home, such as dress yourself, feed yourself, find things that you've hidden, etc. Alzheimer's disease is incurable. However, Alzheimer's disease is treatable. Individuals who have Alzheimer's disease are still human beings. They still have needs, desires, the ability to express love and to feel affection. So they should be treated as they have been all of their lives, as valuable human beings. There will be a cure for Alzheimer's disease, I fully expect at some point. But this may be a decade away. So right now, it's up to you and me to care for Alzheimer's patients with as much compassion and as much hope as we possibly can. Our book, A Pocket Guide for the Alzheimer's Caregiver, available at www.alzpocketguide.com, helps to emphasize person-centered, hopeful, inspiring care for the Alzheimer's patient, and helps to encourage you who are Alzheimer's caregivers to not lose hope, to not give up the fight, but to continue to love your loved one in their current state. Thank you.